Yeah, so the question is around diagnostic tools in the area of cancer. So diagnostic tools in cancer, that's a broad range. We most recently have thought about and focused on molecular diagnostics, companion diagnostics, and really the explosion in genetic testing, proteomic testing, and we see some real value, some very, very real value. On the other hand, there are a range of tests that have a questionable impact on the course of treatment. In fact, some of these tests can, metaphorically speaking, take one's eye off the ball. So we do see that, that the explosion in the number of genetic molecular tests can be a cause for some overuse, inappropriate use, and again take us down pathways that are not in the patient's best interest, that may have some academic interest right now, but not any true clinical significance. And I've had oncologists who know far more about this area than me express that to me as well. There are other diagnostics. There's the use of advanced imaging, and we know that some advanced imaging is very vital. On the other hand, PET-CT, for example, in certain stable breast cancer patients to do repeat scans is not, there's no evidence to support that. So that's another area where we're cognizant of working toward appropriate use. So the question was around how we might support clinicians around clinical pathways. We do not have proscribed clinical pathways that we have endorsed or working with a third-party organization, as some health plans do, that have developed pathways in cancer care. We do provide our clinical partners with our medical policy, and that reflects a lot of time, effort, energy, and thoughtfulness by clinicians with input from community thought leaders. We do provide analytics to our clinical partners. Increasingly, we're taking what we have in the area of medical economics and analytics and health information to work with, to marry that up with or harmonize that with our clinical organizations. But we do not have explicit or proscribed clinical pathways. We do provide feedback to our clinical partners, and in certain areas of cancer, not CLL is not one of them, but we do have episode of care models that we have endorsed and have advanced in select cancer types.